So a lot of our research focuses on the advantages of using a smartphone in collaboration with a clinician assessment for MS and general neurologic disorders, both in the clinic and from home. I think a lot of it is based on a multifactorial approach. So the clinician assessment is an hour-long assessment. It requires a trained neurologist. Not every single center or population has access to that. And then on the other hand, we're also only human. A lot of the neurologic exam is still quite subjective. So is there a way that we can make that exam more objective and quantifiable and also add a little bit more ease in the mobility and accessibility? So that's what we're looking at with the phone and trying to create the apps. So we created a suite of test apps on an Android smartphone development just because that's what we were most familiar with and had access to in terms of coding. And so these test apps are to assess different neurologic systems ranging from motor function, cognitive visual dysfunction, general fatigue, and strength. So we did games such as a tapping test, a balloon popping test if you can follow a randomly generated stimulus, and then also your spasticity functions, how stable of a motion you can do when you're holding a phone and interacting with it. And so to create this experiment, what we did is we had patients in our clinical trial complete multiple trials of these tests, but we also had patients complete these tests from home, meaning that we did not need an investigator present for the patients to be able to complete the tests, and the patients almost viewed these tests as games. So they were just trying to beat their best scores, which was really good. We took away the burden from the patient. And in the background, though, we were collecting all of the relevant data, meaning the pressure and timing of each tap, the number of mishits. For example, if some of our patients had a tremor and couldn't initially catch the targets for their game. So we were able to assess all of this, and it was all collected through cloud-based monitoring. We had huge spreadsheets and did automated data analysis for all the apps. So our two major findings from my poster was on the tapping test and the popping test following a randomly generated stimulus was primarily our test can differentiate between our healthy volunteer and our multiple sclerosis cohorts, and quite significantly and completely comparably to the current clinical standard such as the 9-hole peg test. So we can differentiate between our cohorts, and this is across dominant hand findings, non-dominant hand findings, average hand findings. But after that, we wanted to see the granularity of our scores. So we saw that the individual scores from each test correlate very strongly and significantly with clinician-derived measures, such as specific scores for upper extremity weakness, for motor fatigue, for pyramidal signs, for cerebellar dysfunction. And not only were these scores significant and strong on the order of 0.7 plus correlations for some of these, they also were stronger at some points than the current clinical standards. So it gave us further motivation to look into how could we potentially incorporate these tests and refine them. So we started looking into derived features because the tap and pop tests were an assessment of functionality. So we said, how can we specifically target, for example, cerebellar dysfunction? And we started mapping out tapping patterns. And we started saying, can we see a quantifiable difference in someone's tapping pattern and their motor coordination through the data that we're collecting in these phones? And we even did other features as well. So I think the capabilities are very, very wide, ranging from collecting more background data, and maybe if we could even do passive data collection where on general phone usage we can assess using different features how steadily someone is holding their phone and being able to pick up tremor, or if we can incorporate maybe sensors so that someone doesn't have to think about holding and interacting with a phone, and we can pick up their gait analysis, their general functions of every single limb individually. And then I also think it provides a bridge between the clinician and the patient, because very often these neurology visits are biannual or annual, especially in these large clinical trials. So this creates an extra connection between our neurologist and our patient to see, are they deviating from their baseline? Is there an alert that we have to address? And can we be more aware of what's happening with all of the patients in a more frequent manner?